Welcome to WeChats, a space for people with diabetes where we bring the experts to you. My name is Will, and I'm a diabetes specialist dietitian and co-founder of We Nutrition. And here at WeChats, we love having relaxed, fun conversations combining diabetes research, the experience of people living with diabetes, and the expertise of people working in diabetes. Welcome to this episode where we're chatting about diabetes, cardiovascular risk, and nutrition using a doctor-led approach to prevention with Dr. Avni, who is also known as the Holistic GP. Welcome, Dr. Avni.
Hi, thanks for having me.
Thank you so much for being here. I know we've been talking for a while, and I have to say, you are the first clinician that I have sort of been chatting to locally who's come to WeChats, and I hope this is one of many that we get to do together. So thank you being here.
Oh, no,
Um,
I'm really excited. I've been the pioneer. So yeah, no, it'd be great, I'm sure.
Avni, can you, for people that are just meeting you today, can you please share a little bit about where you've come from, how you've found yourself in this space? Just tell us a little bit about yourself, please.
Yeah, so I am a GP and I have been a GP. Okay, it's feel very old, but I've been a GP for now 10 years and I've always been interested in kind of the bigger picture. And about 5, 6 years ago, I decided that I wanted to really understand a little bit more about all this gut health thing that I was reading about, all of these kind of nutrition information that I was kind of learning about in the wider world, but I'd never really been taught about through kind of the normal medical route.
Mm,
So I decided to train as a nutritional therapist and really just fully understand what functional nutrition and functional medicine really were.
mhm,
And it was really just kind of my own interest, and it evolved and it really rounded out things that I already knew were kind of driving lots of the health problems that I was seeing, but
mm,
also enabled me to kind of understand where the changes that people actually need to make and
mm,
what those changes need to be to help improve their symptoms. And so I set up the Holistic GP clinic
mhm,
last year to allow me to kind of really help people in the way that I think medicine is probably heading towards, really. And if we weren't within the limits of and the constraints of the NHS, I think it's a lot of the way that most clinicians would like to manage their patients, but we don't have the time and we don't have the resources. And unfortunately, with a lot of lifestyle and nutrition sort of related conditions, even though we talk about preventative medicine and preventative care,
mm,
unfortunately, the budget never goes towards that because the runway that you need to monitor those people for is 20 years. And ultimately, hospitals and the NHS want to see bang for their buck. And that's why we end up with this kind of, rather than a preventative strategy, we are just treating things acutely
mhm.
when they have already gone much further than they ever needed to. And so that's what I do within my clinic is I review people, and people approach me when they've been struggling with things like cardiovascular disease or diabetes, or they've been told they have this new diagnosis, or they are struggling with sort of maybe borderline sugar control or other health conditions like gut problems, and wanting to know what's going on within their body and what they can be doing to optimize things that aren't meaning that they can only act when they've already started having issues. And so yeah, so that's a little bit about me.
Amazing, amazing. So, just to sort of capture this, you're already working as a busy GP. We all know that NHS GPs are really busy, and then you've gone and done your own training in, deep diving into functional medicine and nutrition and exploring gut health and cardiovascular disease. Um, that's insane. That's incredible. It
Yeah, it
must
was
have
a
really
bit.
shifted. Was it
Was a bit.
intense?
I never really. I don't think I thought about it as much as I did, and in hindsight, it was a ridiculous amount of work. But I'm so glad I've done it because actually, I really do understand it in a way that I know a lot of medical doctors wish they did understand it. And what I like to think of is I like to say that I can kind of have a foot in both worlds, and then you get a bit of the best of both. So there's a lot of things that in medicine that we should be doing that we don't do, and there's a lot of things within the wellness sphere that get touted as kind of super things or things that we everyone should be doing, and that's just not true. And you as an individual may benefit from multiple areas of that support, but often actually the guidance isn't there for what actually works for you. And so, there's constant stream of information can really feel overwhelming. And ultimately, well, with the clients that I work with in the holistic GP clinic, it's actually narrowing it down to see what actually that person really does need. And often it's not, a specific food or
Mhm.
a specific diet plan. It's really looking at all of how all these systems interplay and how we can address the main areas to give them a balanced approach that they can therefore live for the foreseeable without it feeling like, oh, I should be taking magnesium supplements, or I really do need to be using NAD. And there's ultimately there's a place for certain things for the right person in the right context, and that's where actually as a doctor that's what we do. That's what we do, but unfortunately it's so lacking in this space, and that guidance just isn't there.
Amazing. It's almost like a deep dive into the person, into, their world, biologically, physically, socially, really rounding out that picture and understanding what's happening at that time. But, having that safetyness as well of the medical background.
Yeah.
That's amazing. Wow. Okay. So, I mean, are there, people that are accessing your services, um, are there any sort of common themes that maybe people are talking about, or are there any common problems that people are experiencing that you hear about?
Yeah, I think it's a lot. Often, it's either that they've been given a diagnosis, like, or something's happened, so
Mm,
they might have been given a diabetes is fairly unique in that there is a structured dietary program that does exist within the NHS, but there isn't that for basically any other health condition, or even stroke, heart attack. Within the cardiovascular kind of window, there isn't that, but regardless, within other conditions, be that endometriosis, be
mm,
that Crohn's disease, having had a stroke. So often people will sometimes people will present to me having had these conditions happen
mm,
and want to optimize their well-being and their lifestyle because they've been told, yeah, you need to look at your lifestyle factors, but then that's the grand total of the advice. And actually there's lots of things that people can do to improve that. And then on the other side there are people who have been struggling with how they're feeling,
mm,
and that can be lack of energy, it can be chronic pain, it could be gut issues, and they've had investigations, they've had tests, and actually they've all come back as normal, but they are still struggling. And again, that's where we're looking at this kind of often like low grade inflammation, or the interplay between systems like your stress, your sleep, how you're eating, your well-being, how you're interacting with the people around you, loneliness, so many factors that actually we all kind of understand, but then really it's just understanding for you as a person, where do you need to focus your energy on to kind of help improve your own health.
yeah. Okay. So it's the people with the diagnosis, but maybe not the support or the pathway or the vision of what's forward.
Hmm.
And it's also the people that have tried to maybe get a diagnosis, but not really getting anywhere, but knowing deep down something isn't right.
Yeah.
Um,
And functionally, there usually is. There usually are lifestyle nutrition factors that we can improve on. And I don't tend to need to work with my clients for a huge amount of time. Usually, I work with them between 4 and 6 months. And sometimes, if it's somebody, for example, I had a gentleman recently who'd had who had some abnormal blood test results and high cholesterol diabetes. He tried to make some dietary changes and was really disappointed that those hadn't really improved. We did a one-off consultation, repeated the blood tests in kind of 6 months' time, and they that had made that change for him. Because unfortunately, again, within the NHS, there's not a huge amount of nuance with the dietary advice, and a lot of the time, actually, it's very outdated, outmoded advice that you see in, like, the leaflets. It's
Mm.
still some of the advice, and you're thinking, actually, that's probably not the best way that you should be eating. Toast and Weetabix in the morning, even with something else, is probably not your ideal choice. And people are thinking they're making a really great choice by having like this. You think, oh, actually, it's not bad, it's not awful, but there are things that you can do to make that much better. And if that is an active choice that you're making because you think it's the best decision, actually, it's probably much better options that we can look at that you would enjoy just as much, that would be just as easy, but would serve you much better.
Absolutely, absolutely. It's that here's a leaflet, I'll see you in 6 months kind of thing, isn't it? That
Yeah.
we're kind of working against. And yes, that is a situation in some for some, scenarios, but we know there is so much more.
Yeah.
So this is why I'm so excited to jump into our conversation, because we're talking about diabetes and the link between blood sugar or blood glucose and insulin resistance and cardiovascular disease. There's some big words in there. So I just want to, for the people that are listening, I just want to break it down. When we're talking about cardiovascular disease, what are we talking about?
So cardiovascular just means your blood vessels and your heart. That's all it means. So anything that affects anything involving your blood vessels or your heart, and that's what we're talking about. And those blood vessels can be anywhere. They can be in your brain, they can be in your heart themselves, and they can be in your fingertips, in your kidney. It can be anywhere. So that's what we're talking about when we're talking about cardiovascular disease.
And if we take that into sort of the diseases or the conditions, maybe, I guess we're thinking about heart attacks, strokes, maybe sort of the veins and the arteries in the legs as well.
Hmm.
And maybe if they're not working particularly well, in diabetes, we might be thinking about the blood flow in the extremities, so the
Hmm.
feet. We're always looking at feet if people have
Mm.
diabetes. Okay, and if when we're talking about diabetes, we know there's loads of types of diabetes. Where would you narrow it down to one type of diabetes, or would you think all types of diabetes here?
In terms of kind of long-term health, all types of diabetes need to be managed.
Mhm.
So the one that we all know mainly is type 2 diabetes, because that's obviously got the higher number of people that we
Mhm.
end up seeing. And often the type 1 diabetics get really great management because they are young children, and obviously it's a lifelong condition, and it's got huge repercussions for all of those areas that they struggle with. And so actually for them it's more the sugar control, whereas with the type 2 diabetics, actually inflammation comes into it considerably, because we know that there is this really strong link between inflammation. So if I was seeing a type 2 diabetic, we'd be looking at other things that could be contributing to that inflammation. So the diabetes is one aspect, but it's also a marker of systemic inflammation, and inflammation that can come from lots of different ways, not just your blood sugar control. We can look at things like your gut health, which has an impact. There's all sorts of areas that impact your inflammation. And then I know you've got an interest in gestational diabetes as well. So obviously another another marker, and along with women who've got polycystic ovaries, where the fact that they've got the gestational diabetes or polycystic ovaries is again tying in with that increased risk of metabolic conditions in the future and increased inflammation.
Absolutely. So we're speaking to those people with an interest in diabetes, or people, women with gestational diabetes, people with pre-diabetes, type 2 diabetes, and type 1 diabetes,
Mhm.
because it's all connected. Heart health, blood vessels, all over the body, the glucose management. Um, what, can you sort of share with us the link you've mentioned inflammation there, the link between cardiovascular and glucose management. Can you talk us through that a little bit more, please?
Yeah, so sugar, so your sugar control has a direct impact on inflammation just on its own. So when you have too much sugar circulating and it's not getting adequately removed or removed quickly enough from your blood vessels, that causes damage to your blood vessels, and that leads to stiffness, and that stiffness then leads to more so kind of some furring or plaque development, and that can lead to narrowing, and the narrowing is the thing that leads to some of the conditions that you've mentioned already, things like strokes, heart attack, peripheral arterial disease, all serious, very, very end point consequences. And so by addressing these much earlier precursors to that, the hope is that that will never happen. The stroke will never happen. The heart attack will never happen. The peripheral arterial disease will never happen. If we can kind of manage that sugar control, because that directly causes a lot of the inflammatory changes that lead to these kind of health conditions.
So by keeping the glucose levels in target, we're keeping the blood vessels nice. I often think about it like a rubber tube. You know,
Mm,
if you have a stiff rubber tube and you put pressure through it, you're passing water through it or air through it, it's more likely to crack and burst and you're going to have a leak. And
hmm.
if that's a blood vessel, that is bad news. We want flexible tubes. We want bouncy almost tubes.
Yeah.
Um, and it's the word du jour is prevention. Um,
Mm,
we're talking, please, I'd love to hear your point of view on this, but we're talking 20 years, 30 years, 40 years, we're looking into the future and we're
mm,
saying, hey, we're making changes now so that in 30 years' time, I'm not having those conversations about heart attacks and strokes.
yeah, absolutely. And chronic pain and nerve damage and kidney problems, sort of, it's not a fun list.
No, no, absolutely. We're staying away. We're staying away from that. Okay, okay. So, if I know traditionally maybe in diabetes management, if someone's diagnosed with diabetes, any type of diabetes, the conversation about complications comes in quite soon.
Mm,
We're doing this to keep glucose levels in target so that these complications don't happen in the future. Um, and I quite often share with clients, that is scary. I completely appreciate that is scary. But the fact that we're having this conversation is avoiding that. The
mm,
fact that you're turning up and having blood tests and keeping an eye on things, having an annual review, all those actions tell me that we're going to avoid these complications. Um, but, I wonder if there's a time where you might look out as a GP, you might look out for these complications a bit more. Would it be 5 years down the line, 10 years down the line, 20 years down the line into the diabetes journey? Is there anything there for you?
so part of your annual review is to hopefully identify some of the early changes, and then if there are some of those changes, it may be that we need to look at your blood sugar control. But the reality is that there are multiple other factors that can be contributing to that inflammation, and so it's one piece of the puzzle is managing that sugar level, and making sure that you have those annual reviews, because it for sort of one person it could be 5 years time, and that may be related to their sugar levels, but it could be other lifestyle factors that are also accelerating that difference. So two people could have the exact same HbA1c at diagnosis,
Mm.
and 5 years could look very different for one of those people compared to the other. And some of that is genetics, and some of that is the other lifestyle factors that we also have to take into consideration. So it isn't as simple as just you can manage your sugar and that's it, and then it's fine. It's taking you're looking at your sleep, your muscle mass, your like your diet, your gut microbiome. So I think that approach, hopefully that approach will be just the normal, and taking ownership of your own health is so important. And I think so many more people are doing that, which is fabulous. I remember when I started as a GP, having these conversations would just be an anathema. Like, it would not be something that people would be open to. But I think there has been a culture shift, and it's really lovely to see actually how much people are willing to sort of make those lifestyle changes. And certainly when you're talking about complications within 5 years, 10 years, 15 years, 20 years, that kind of approach really does have an impact on those trajectories.
And I guess it just speaks to the importance of having individual treatment. Because, like you say, two people could have the same HbA1c diagnosis, but they're on very different paths because there are other factors at play that contribute to the inflammation.
Mm,
Um, and it's interesting you mentioned the cultural shift. I feel that massively. The
mm,
people that I work with at the hospital feel that massively. I kind of feel it since COVID. I don't
yeah,
know what
I
was your
agree.
experience of that?
Yeah. Yes, I agree. I think social media, like, at the end of the day, that understanding of it's one thing being told it from your doctor, it's another thing finding relatable people that understand you, that speak to you, that you then can go, actually, yeah, maybe that is something I need to do. And the great thing about social media is you can find everything out there. And so there is this wealth of information that you can then filter down to exactly kind of your demographic, your issues, your personal kind of story. And you're not going to relate to that person completely, but there will be aspects and you go, oh my goodness, yeah. Yeah, actually, maybe I do need to start doing more strength work. Maybe I do need to look at my gut health. Maybe that is something. And I think that actually for most people, some of those small changes are just all that they need. And then for other people, they need somebody to look at the bigger picture because it is too complicated for them to really, and they've tried doing a bit of this and a bit of that, and it may be that the accountability isn't there, or there are some barriers to that change that make it difficult for them to implement those changes, or it could be that they're trying to do absolutely everything all at once. It's super overwhelming, and they're not getting that change that they need to. And this is where people like you and I can come in to support them, to kind of help round out that information and make it easy for them to implement into their lifestyle.
Absolutely, a little bit of road mapping.
Mm,
Um, and it's interesting you've mentioned social media there. We're more connected than ever
mm,
with people that we've never met in real life.
yeah,
And with the advent of AI as well,
yeah,
people are able to access that, which I'm seeing more and more,
yeah,
um, AI doing meal plans, AI
yeah,
doing recommend exercise regimes for particular conditions. One of our other podcasts, we spoke to Chris Shayette, and he was talking about AI and diabetes. And the way he put it was beautiful. He said, AI is a bit like your sat nav. You trust it,
yeah,
but you're still driving the car.
yes, yeah,
Um,
100%.
and I think it's kind of like that with social media, isn't it? You might see other people's stories and relate to some aspects, but
Yeah,
not every aspect. And you know what?
yeah,
If we're talking about health, which we are, um, I would hope that it's good, reliable evidence.
yeah. And that's where it falls down a little bit. And there's always bits of it are relevant to the right person in the right context. And I mean, there's a reason why as a doctor, it's impossible to treat yourself. And I know from my own experience with my own children, it's
Mm.
really, really hard to doctor yourself and your own children because emotions come into play. You're just not rational about it. Having somebody take an objective view and looking at that information is so valuable because it's very easy to overthink things and then very easy to ignore things that suit you, and actually kind of taking the medical approach where we are systematic with what we do, we have a system with how we approach things, we look at that and then we pull it together, makes the world of difference. And hopefully over time, this becomes a more established way of working. You know, at the moment, we are in the forefront. You and I have had to kind of go out on our own a little bit with trying to support these patients in this way because it isn't supported. But I don't see a future where this is not a normal way of managing people in the next 15, 20 years. It's just that it's a novelty for now.
Absolutely, absolutely. We're going to get there. We will get
Yeah,
there.
yeah.
So you've mentioned lots of factors there for inflammation. We've talked about nutrition, gut health, lifestyle. We know that lots of things contribute to diabetes and heart health. What do you see as the biggest factors that contribute to these issues?
I think diet and sugar control are the absolute keys. So making ultimately, if your sleep is right, your stress is great, you've got a great muscle mass, but you eat absolute rubbish, doesn't matter. Those other things, it doesn't matter. You can have the most, the food is the absolute starter point. That needs to be as a foundation at a level. And that doesn't mean that you need to be having a side berries with every you don't need superfoods. It doesn't need to be fancy. It needs to be balanced and it
Mhm.
needs to serve you. And that doesn't need to be an exceptional diet for that to happen. And then the other factors then come into play to help modulate some of the things that I sort of slightly mentioned, things like your gut health and things like that, which there we are understanding more and more about, and is certainly an area I'm really interested in, and that I see huge improvements with people when we start addressing that, really.
Would you feel comfortable sharing some of those with us?
Yeah, so what would you like to know?
Is
Where
it
do you want me to start?
the gut health aspect?
Yeah.
What are the big wins that people are having?
So the gut health plays such a much bigger role in inflammation than people realize. So the microbiome influences your insulin sensitivity, inflammation, and even your appetite regulation. GLP-1s, a lot of that is influenced with your microbiome. And when the gut's disrupted, you often see an increase in permeability and therefore a rise in kind of systemic inflammation, which then feeds into the diabetes and cardiovascular risk. So quite often I'll see patients with metabolic issues who've got underlying gut dysfunction, generally due to kind of multiple factors, but often sort of diet, lifestyle, all of these interplay on them. Blood sugar control is essential for a healthy microbiome. So when you have a high sugar diet, you end up basically killing the good bacteria that you want and creating a environment that does not allow that good bacteria to kind of thrive and grow. And so it's kind of chicken or egg. And I mean, I'm hoping there will be some studies on it and that will help us understand it, but they go hand in hand. So you cannot have poor, poor, high sugar intake and not have a disrupted gut microbiome, as well as eventually having problems with your sugar regulation the the within your blood vessels.
Okay. So if we think about the gut microbiome, we're thinking about all the trillions of little bugs that kind of exist
Mhm.
inside of us and give us really, there's good bacteria, and they're giving us all these amazing chemicals that look after our gut, that look after our metabolism, that support our health as well. But we know that when the diet is flooded with high sugar, highly processed, refined sugars,
Mm.
really artificial things, all those trillions of bacteria, the gut microbiome, it gets dysregulated, it gets disrupted, it starts malfunctioning in some way, and
Mhm.
that's when we see the problems happen.
Yeah, absolutely. And that's where things that shouldn't be entering our blood system and that should just be getting eliminated through our bowel movements are then on a molecular level coming across and driving some of these inflammatory changes, and that leads to worsening of some of the blood vessel damage that we've already mentioned that happens when you've got that stiffened kind of pipe work, as you said, but also your appetite regulation. So when you are eating kind of like a high sugar diet, your gut plays a really large role in appetite regulation. And so there are some molecules that are responsible for that. And so, as I said, there's these GLP-1 blockers are, like your Ozempics and your Wegovy's, those kind of medications can help block some of those molecules. But if your gut is dysregulated, those molecules become even more dysregulated, and those cravings, the crashes, the need for certain foods, and erratic eating patterns become even more
Mm.
dysregulated, and that feeds into the kind of glucose instability. So there's the work that's needed to manage your diabetes often comes hand in hand with how we would manage gut your gut health as well, which is a really lovely coincidence. But so when we're talking about refined sugars and refine all those foods that we know are delicious but do not serve us, we are now seeing the evidence more so within the gut microbiome, not only at the kind of blood sugar kind of level.
Absolutely. I love that because it's almost like a two for one, isn't it?
Yeah, exactly.
If you maybe make a few tweaks, and I know we're going to come on to sort of the easy wins, the changes that can make a big difference a little bit later on. But if you can make those changes, then it reduces the inflammation, but it
Mhm.
also reduces future complications with inflammation and with diabetes.
Yeah.
I love that. I love something that is small change, big win.
Yeah, absolutely. Like you said, two for one.
So let's jump it into food because we're
Mhm.
saying refined sugars. I instantly think about sugar, white sugar, brown sugar, molasses, sweets, biscuits, chocolate, cake, sweet pastries. Um, you know, we could almost throw fruit juice in here as
Mhm.
well because that is really refined. If we see sugary drinks on the shelves,
Mhm.
fruit juice or smoothies, um, you know, they've got benefits because they will contain the juices and smoothies will contain vitamins and minerals and maybe a little bit of fiber, but there is a whole big sugar content there as well.
Yeah, absolutely. And I mean, the thing is they're hyper palatable as well. So they are things that you also will continue to want to eat. So usually when I work with clients who are struggling with their sugar regulation, what we try and do is do a full reset because your body has become so used to having that
Mhm.
sugar that actually what often we need to do is kind of allow it to reset. And it's amazing what that does with your cravings because the cravings can really, really mess with your ability to eat the foods that your AI plan has come up with. But actually, you've had a long day, you're tired, and you just want to eat that because that is your body's just got so used to that. So often, actually, we have to remove that drive first to allow you to then kind of get into a more normal way of eating because it can be really difficult actually for a lot of people who, like you said, have been having like smoothies and bananas and grapes and thinking that these are like kind of quite healthy foods and actually how used to like a constant drip of sugar they've kind of got used to because of the nature of our society and the way that kind of the food culture is really. It can be really, really difficult.
Absolutely. I mean, these types of foods that we're talking about, the high sugar foods, they sort of appear at a lot of social occasions and
Yeah.
festivities and events. It's not really a celebration without cake, that
No,
kind of
yeah.
thing, which is really difficult to navigate socially as
Yeah.
well. Um, you know, so do maybe after the reset, do you think there is a place for these foods in particular situations?
So the way I would frame it is that if you can stick to something 80% of the time and 20% of the time you have a bit more freedom,
Yeah.
that's reality. You're never going to have 100% with anything. And if
Mm.
a smoothie or a fruit juice or a piece of cake is the absolute joy of your food, that should go in your 20%. But everything in your 20% should be things that you absolutely love.
Mm.
Not that just you just shovel in just because it's there. And sometimes again that's unpicking a little bit of that. And so this again is where the one-on-one work becomes really valuable because why are you having a cake? Do you love that cake? Is it really delicious? Or do you feel that there's pressure? Do you ever notice anybody not eating cake and does that bother you? Do you need to have the cake or could you have like a small amount and have it with something that balances that sugar release in your body so you're not getting like such just a hit of sugar. So there are ways of of enjoying food and you have to have joy from food. Like food is social and it is exciting and it is joyful, it's one of my favorite things, why I'm so obsessed with it. But the reality is that your body is still needing to be looked after. So, I would say that enjoy it, take your time with it, really, really enjoy that. Don't just shovel the whole thing in and not even think about it, because often that is not serving you. And so I think when it comes to kind of sugary treats, it's being intentional with it and it's understanding how to have it that serves your body. So maybe you pair it with protein, or if you're going to a party, you have something before you go that is a nourishing, full enough meal so that if you were tempted with the delicious cake and it looks amazing, you'll have it, but you're not going to have like three pieces. You're going to have one piece and really enjoy it and really, really be glad because actually you've enjoyed that piece of cake, but you've also eaten a really good meal that has served you and has allowed your blood sugar to not just yo-yo, has kept it all within that kind of realm of acceptability for your body. Your body's fine with having some sugar, like lots of us are, but when your body's already showing signs that it's struggling with that sugar control, we have to support that. And there are lots of techniques that you can use to help support that.
Absolutely. I love that idea of, go moving with an a way of intentional eating. 80/20. Love that. Love that. That's a fantastic strategy because I I quite often say to people, if you expect perfection in an imperfect world, you're going to drive yourself bonkers.
Mm.
Perfection doesn't exist. It doesn't matter what we see online. It doesn't matter what we read or what we hear. It's perfection isn't there. And if we keep chasing it, we're just going to drive ourselves to distraction. So
Yeah.
having that balance, having that mindful approach is beautiful. I love that.
Mhm.
Um, so if we, you know, we've talked about the big factors here. We've touched on sugar. Um, would there be any other big factors? I'm almost thinking about alcohol. What do you think?
Mhm. Yeah, I mean, again, it fits with the cake. So if you're going to have
Mm,
it, be intentional about it, understand what it does and what impact it has on your body. We know that alcohol in excessive amounts, we know what it does to us. And I don't think anybody's under any illusions. The problem with alcohol is not only the sugar content of the alcohol, it's the associated behaviors. So if you have a couple of glasses of wine, a kebabs in your horizon, a Mackie D's the next morning, you're gonna be feeling pretty grotty, so you probably want to have a pizza. Like if you know that those are the 2 days, you need to think about it. And I also would say that from my experience with working with people,
mm,
actually, once you get used to how good your body can feel,
mm,
when it when you put it through that you're not doing that multiple times because it really throws you off. However, if you are
mm,
somebody who can enjoy a glass of wine with a meal where that sugar is buffeted with a meal and you will keep it to one glass and that's your 20%,
mm,
we can fit that in and that's where a longer term plan fits. But if you're somebody who once that bottle of wine is open, you're going to drink the whole thing, you're probably going to have a whiskey at the end. Like it's and that's where that personalized kind of approach comes in because we have to understand what is it about you, what do you enjoy, what does it trigger for you, how do you drink, why do you drink, what makes you stop, what makes you keep going, what do you do around that behavior. So really great because you can make such a difference and people, if we want to enjoy something, you can continue to do that, but we need to work together, find out a way of kind of making that practical for you.
absolutely. So we've got the intentional eating. We've identified the refined processed sugars. We've identified alcohol contributing to that inflammation, which is shown perhaps in pre-diabetes or in diabetes with the glucose levels going up,
Hmm.
giving hypoglycemia. Maybe longer term, we're looking at things like high cholesterol or high blood
Yeah.
pressure that all comes, it's painting that metabolic picture. Um, we've got some really good strategies here with the 80/20 and the mindful eating and, really focusing on what brings joy in that 20%, but unpicking it more. Um, are there any easy wins that, sort of spring to mind when you're working with people in this space?
Absolute basics are hydration, making sure you're hydrated throughout the day, because often you mistake thirst for hunger, and that's often where you go for the quick bicky or a bit of chocolate. Always trying to pair a decent amount of protein with every meal. So whatever that's like, again, every snack, every meal, finding ways of getting a decent amount of protein in. Not only is that helpful for your energy levels, but also for buffering that sugar
Mhm.
control, and it helps with your satiety in all sorts of areas in terms of your inflammatory response and your microbiome. And the other thing I would say would be pre-planning and planning what you're probably going to be having that day, if not the next couple of days, and having set things that are your A, B, C, D, E options. So you have kind of like a fixed, most people have one, maybe two breakfasts that they will have over and over again, and that's all they'll have, and they will have that for years. And instead of it just being Weetabix or toast and jam, there are lots of other options that can be available to you that would serve you better. That especially when you are insulin resistant or pre-diabetic, that can be
Mhm.
really great for you to start your day with. And that first meal, because you've been fasting overnight, that first meal is so important, and it's often what disrupts the rest of the day. So people either skip it completely, which again is is right for some people and not right for other people. So again, we need to like dig in a little bit about whether intermittent fasting or time restricted eating is the right thing for you. For some people, it really isn't. For some people, it's great. But it depends on your factors. But that first meal, sourcing out that first breakfast meal is an absolute essential. So, and I find that it's like one of the easiest wins, because most people are happy to stick to one or two options. And as long as we can figure out what those two are, they're off and running.
Fantastic. So we've got hydration now,
Hmm.
making sure that we're well hydrated throughout the day so that we don't mistake hydration as hunger or cravings. We've got the pairing with protein and we've got the planning. Now you mentioned breakfasts earlier. You said, I think Weetabix has this absolute health halo effect. People t say, I'm having Weetabix for breakfast and it's so
Yeah,
it's so good for you. And every time I'm like, no, not the
yeah,
Weetabix.
yeah.
So, breakfast, the most important meal of the day.
Hmm.
What would you be talking about there to navigate inflammation, stable glucose levels?
Yeah. So if you are pre-diabetic or diabetic or within that window, or you're just worried about your metabolic health, starting your day with healthy proteins and healthy fats will be the best way of starting that day. You don't really need to have carbohydrates as your prime source of energy first thing in the morning. And so for most people, eggs are a fantastic option, or Greek yogurt or skyr, also wonderful, or leftovers from the night before. They can work brilliantly for a lot of people. Just need to mentally get your head around the idea of having that as your breakfast. But it's finding what works for you. So those are a couple of very easy ones that I usually recommend. And then smoothies are also can be a really, really great option. So again, so blending some frozen berries, some veg, and some Greek yogurt is a brilliant way to start your morning. And another one that I sometimes recommend is overnight soaked chia seeds can be also really fabulous. And so those are my kind of top go-to breakfasts, really.
Fantastic. So we're peering into the world of protein, which usually looks like eggs in the morning
Hmm.
in some form. Um, but we're also peering into the world of fiber as well. High fiber foods. You've mentioned berries, vegetables, the sort of the seeds and nut
Hmm.
family. Um, I there's I've got a little pot in my freezer with fresh ginger that's been grated.
Hmm.
And I've seen this in the supermarkets as well. You can get it in the freezer section, but it is one of the best things in the morning in a
Yeah.
smoothie. It's a real sort of kick, a real nice wake up.
Yeah,
Um,
no, exactly. You find the combo that works for you, and it can be really great. And protein powders in the morning, if that's your bag, there's lots of very ones with minimal ingredients that if you have a good look around, but it's just about tolerance factor. So for a lot of people, they can't tolerate certain protein powders. So it's just again there are a few ones, and again with protein powders, certain ones are not complete protein. So it's just making sure that what you are having again is doing what you think it should be doing and not achieving what you want it to be.
Absolutely. And you mentioned hydration as well.
Mhm.
What sort of hydration? Smoothies would provide some hydration.
Mhm.
Would you be looking at any other sources of hydration to start
Yeah,
the off, right?
good old water. So yeah, so water just steadily throughout the day. You don't want to be chugging it all in one go and then nothing. So having a big pint, a couple of pints in the morning and then nothing, trying to drink it steadily throughout the day. I mean, we do it happily with tea, but
Hmm.
for some reason we don't do it with water. So, just trying to sip water and having a bottle on your desk or along with you is really easy because you just will when it's in front of you, you'll quite happily sip it. So yeah, that's that. But just generally, yeah, water.
Absolutely. And I think there's that notion. It's strange, isn't it? Because if let's say we sleep for 8 hours, hopefully, if went through the day, 8 hours through the day without hydration, we would have a really bad headache.
Mm.
And just because we maybe don't have that headache when we don't wake up doesn't mean that we're not dehydrated.
Yeah.
Getting that hydration in as quickly as possible and then regulating it through the day with cues like hydration apps or having, like you mentioned, having that bottle or that glass on the desk, having it in the bag. um I almost want to go back to the days of regular tea throughout the day and having the opportunity for regular tea. That'd be great. There's a ceremony there.
Yeah,
um
absolutely.
but yeah, okay, fantastic. So we've got some wins at breakfast there. We've got some great ideas for breakfast there. um we've got the protein, the pairing, the planning. And I think, we touched on this lightly earlier. If people are having worries about their health or they're having worries about glucose management, when would you think they would start implementing these strategies? At
I
what
mean,
point?
you can start implementing them now. So, without getting into the world of what's called orthorexia, where you get obsessive about what you're eating and the nuances of it, what
Mhm.
we've talked about today, nothing we've said so far is anything that does not is not included in like as part of a healthy diet and
Mm.
actually would serve most people. And that low grade inflammation can drive lots of different health conditions, not just cardiovascular conditions, which is what the topic of conversation is today, but also it has an impact on your hormone health, it has an impact on your fatigue levels, it has an impact on pretty much there is not a health condition where the management strategy is not lifestyle interventions.
Mm.
Unfortunately, those are the only two words that ever exist in that. That's a full sentence, apparently, according to medical literature. It doesn't dig down into what those are, but these are all really good fundamental places that you can start to help moderate inflammation for across the board. So I would,
Nutrition, diet, and lifestyle is like that's in the medical literature. It's the full sentence, but it doesn't dig down into what that actually means in practical terms for people.
yeah.
Um,
So I
okay.
would say that all what we've spoken about today is already a good place to start. So balancing your meals, starting your day with some of the meals that we've already spoken about
Mm.
would be found for the vast majority of people. But depends on you, and if you're ever not sure, reach out to somebody like me or you, and we can advise you. Or, to be fair, most GPs now actually are getting more and more. Um, are improving with
Mm,
with their understanding. So I would say that in terms of testing, you should you know, at 40, everyone is entitled to a health check, and that would check
mhm,
for your HbA1c and your cholesterol levels, and that will give you
mhm,
a good idea of your level of insulin resistance and whether there are signs that your cholesterol is perhaps not as well managed as you would expect. And so at 40, you're entitled to that NHS check. But if there is any
mhm,
family history or there are concerns about your metabolic health, for example, if you've had gestational diabetes or if you've got polycystic ovaries,
mhm,
again, you should be having your HbA1c checked annually
mhm.
after that diagnosis so that we can monitor things.
Absolutely. So, I guess it's never too early.
Hmm.
These could be used by any adults in
Hmm.
a really healthy, positive manner. But if something is flagged, like high cholesterol, high blood pressure, higher glucose levels, then really we're rolling into that annual review to have
Hmm.
that focus, that more regular focus. Okay, fantastic. Avni, this has been fantastic. Thank you so much for sharing your experience and your wisdom with us. If people are looking for you, where can they find you?
So yeah, so you can go to my website. So that's www.holisticgpclinic.co.uk, or I'm also on Instagram and LinkedIn under the Holistic GP. I think that's what it's
Mhm.
under. Pretty sure it is. So yeah, you can find me there. And if you want to reach out and see if you want to work with me, then I'd be more than happy to have a chat and explain how I work and what that would involve.
Mhm. And you have a lovely website. I'm very jealous of it.
Well, thank you. That's really kind of
Fantastic.
you.
Thank you so much. And I hope, we will have many more conversations and people will be able to take some of these gems away with them today. For people listening, if you want to hear more of the fantastic conversations that we're having in WeChats, then please check it out on Spotify, on Apple Podcasts, and you can see us sort of recorded visually on YouTube as well. But yeah, go and check out We Nutrition UK socials to find all the latest for diabetes and the world of nutrition and health. Thank you so much.
No worries. Thank you.